Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Subcutaneous injection for pediatrics. Introduction. Most people are nervous about giving an injection, especially to a child. This is natural, but once you learn the procedure and practice it, the nervousness should get better. This program explains how to give a subcutaneous SC injection to your child. A subcutaneous injection means an injection in the fat layer under the skin. SC injection. Injections are given when the medication cannot be taken by mouth. Some medications, such as insulin and heparin, must be given as a subcutaneous injection. An injection places medication into the tissue below the injection site. From there, it will be absorbed into the bloodstream and carried by the blood to the rest of the body. A subcutaneous injection is an injection given into the fatty tissue just below the skin. The word sub means under and cutaneous means skin. In children, the following areas of the body have more fat tissues under the skin than other body parts. Back of the arm, halfway between the shoulder and elbow. Below the waist of the abdomen, but not right around the belly button. Middle outside part of the upper thigh. Your child's doctor will determine how often he or she needs injections and how much medicine is needed. A single dose is the amount of medication your child gets in one shot. Be sure to change the injection site every time you give your child an injection. This is called rotating the sites. Preparations. You will need the following supplies for the injection: a syringe with a needle attached, medication vial, alcohol prep pads, biohazardous waste sharps container, cotton balls, gloves, optional. A syringe consists of a tip designed to fit the hub of a needle, a cylindrical barrel, a close-fitting plunger. To keep the syringe sterile, hold only the outside of the syringe barrel and the plunger's handle. Do not touch the tip of or the inside of the barrel, the inside of the plunger, or the needle. The medication vial is a glass or plastic container with a rubber seal at the top. A safety cap protects the seal until it is ready for use. Air may be injected into the vial to allow easy withdrawal of the solution. A vial can have more than one dose in it. Check the medication name and expiration date. Do not use if expired. If the vial has cracks or leaks, or if it is discolored or contains particles, do not use it. Select an area that is clean, uncluttered, and large enough to work. Make sure there is good lighting. It is best to give the injection where your child does not sleep or rest. Wash your work area with soap and water. Use liquid soap whenever possible. Wash your hands. Bring all needed supplies to your work area. The following are tips for effective hand washing. 1. Wet your hands and wrists under warm running water. 2. Apply soap, liquid soap if possible, and lather well. 3. Scrub your hands and wrists for at least 15 seconds. 4. Pay special attention to the fingers, fingernails, and the back of your hands. 5. Rinse hands well with warm running water. 6. Dry your hands using a clean paper towel, starting with the hands and working down towards the elbows. 7. Use the paper towel to turn off the faucet. Remember, you turned it on with dirty hands. You can prepare your child for an injection and make it less stressful for you both. For young children, give them a toy or other favorite object to hold. Young children may also need an adult to hold and comfort them during the injection. For older children, be honest and explain that the shot may hurt. Tell your child why they need the injection and what you are going to do. Also, explain that you need your child to hold still while receiving the injection. Some older children may also want to help with the injection. Your child may help with gathering supplies, cleaning the injection site with alcohol, or putting on a bandage. Helping with these tasks may make the injection less scary for some children.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Procedure. Giving a subcutaneous injection includes the following basic steps. 1. Get the supplies. A syringe with a needle attached. Medication vial. Alcohol prep pads or 70% rubbing alcohol. Biohazardous waste sharps container. Cotton balls. Gloves, optional. 2. Wash your hands well. You can also put on gloves after washing your hands. 3. Prepare the medicine vial. A. Remove the safety cap from the vial and discard. This exposes the rubber seal. Once the safety cap is off, you can't replace it. B. Cleanse the top of the medicine vial by rubbing vigorously with an alcohol wipe or a cotton ball wet with alcohol. Clean for 30 seconds and then let the alcohol dry. 4. Identify the correct dose of medication. A. The lines on the side of the syringe show the dose. B. To measure the dosage with a syringe, look at the top edge of the black plunger tip. See that it is even with the line for your child's dose. C. Mark the dosage on the syringe. 5. Draw up the injection. A. Open the syringe package. Make sure the needle is on the syringe tight. Remove the needle cap. Do not let the needle touch anything. B. Fill the syringe with air by pulling the plunger just to the amount of medication your child needs. C. With one hand, hold the vial steady on the table. With the other hand, put the needle through the top of the medication vial and push on the plunger, injecting all the air into the bottle. D. Without removing the syringe, turn the bottle and syringe upside down so the bottle is on top. E. Hold the vial between the thumb and middle finger with the hand that you do not use for eating or writing. Grasp the end of the syringe barrel and plunger with the thumb and forefinger of the hand you do use for eating and writing. F. Make sure the tip of the needle is in the medication or you will be pulling in air. G. Pull back on the plunger until you have slightly more than the correct dose of medication. H. If you see air bubbles in the syringe, flick the syringe with your finger right at the bubble to help the bubble rise to the top. Push the plunger until you see all the bubbles go into the bottle. Pull more medication slowly into the syringe until you have the correct dose. I. When all the bubbles are out and you have the right dose in the syringe, take the syringe out of the bottle. Be careful not to touch the needle with your finger or bump it against anything. If you do, you will need to start over. Without allowing the needle to touch anything, put the needle protector back over the needle. 6. Choose a site. The best site for injection is an area on your child's body with a layer of fat between skin and muscle. Up until a child is 12 months old, the best site is the fatty area of the upper thigh. For young children, 12 to 36 months old, the best site is either the thigh or the back of the upper arm. Children older than 36 months of age may receive injections in the thighs, outer surface of the upper arms, abdomen except the navel or waistline. It may help to have another adult that your child knows and feels safe with. This person can help prevent too much movement by holding your child in a firm hug during the injection. 7. Clean the skin. Using an alcohol wipe or cotton ball wet with alcohol, scrub an area about 2 inches around the injection site. Start at the center and scrub outward using a circular motion for about 15 seconds. While the area is drying, pick up the syringe and remove the needle protector. To keep the needle sterile once you have removed the cap, do not set it down or let the needle touch anything. 8. Insert the needle. A. With one hand, gently pinch your child's skin by pulling the skin toward you. B. With the other hand, hold the syringe between the index finger and thumb, steadying it with the second finger as you would a pencil. C. Holding the needle at a 90-degree angle to the pinched skin, Insert the needle with a quick, short movement into the skin. For some subcutaneous injections, you may be instructed to use a 45-degree angle. 9. Inject the medication. After the needle is in, let go of your child's skin. Hold the syringe and slowly push down on the plunger with your finger until all the medication is given. This will get the medication into the fatty tissue of the thigh, arm, or abdomen. 10. Withdraw the needle. Pull the syringe out quickly and smoothly. Press a cotton ball against the injection site for a few seconds. Do not massage the injection site. There may be a tiny drop of blood or a small black and blue mark at the injection site. This is normal. You can also apply a Band-Aid to the site to prevent further bleeding. Children may see getting a fun, colorful Band-Aid as a reward. Do not recap used needles. This reduces the chances of sticking yourself with a contaminated needle. If a person accidentally gets stuck with a used, contaminated needle, seek immediate medical care for evaluation and possible treatment. 11. Dispose of the syringe and needle. Dispose of the syringe and needle in a biohazardous waste sharps container. Your town or state may have laws about disposing of these objects. Check with a healthcare provider for specific instructions. 12. Remove gloves if you are wearing them and wash your hands again. 13. Record the injection. After each injection, you should write down the date and time of the injection, the amount of medicine given, the injection site that was used. Risks and safety. Subcutaneous injections are very safe. However, complications can happen if an injection is given incorrectly. It is important to know what precautions to take to avoid complications and what actions to take if they do happen. Complications include infection, needle breakage in the skin, and hitting a nerve. Infections may happen if a dirty needle is used or if the skin is not cleaned properly. For this reason, you should take time to clean your child's skin thoroughly and never use a needle and syringe more than once. Always make sure the needle does not touch anything before using it to inject medication into your child. Signs of infection may include redness, swelling, and warmth at the injection site. If the redness, swelling, and warmth last longer than 24 hours, call your child's doctor. Call your child's doctor if you see any drainage from the injection site other than the occasional drop of blood immediately after the injection. Needle breakage in the skin may be avoided by always giving your child an injection in a quiet, private place where there is no danger of being accidentally bumped. Also, explain to your child that he or she needs to stay still during the injection. If your child is unable to hold still by themselves, it is helpful to have another person they know and feel safe with help to hold them still. Hitting a nerve may happen if the wrong injection site is chosen. Therefore, take time to choose your site carefully. If your child has numbness or severe pain following an injection, notify your child's doctor.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A subcutaneous injection is an injection given into the fatty tissue just below the skin. These injections are given when the medication cannot be taken by mouth. They are also given when faster absorption is desired. Giving your child an injection is simple and safe. This program explained the procedure and its safety measures. After practice, any nervousness you may have should disappear. Thank you for using Explain.